Hello, everyone. Welcome to this session in the series in celebration of the 70th anniversary of IUHPE. I would first like to acknowledge that I'm speaking to you from the ancestral and unceded homelands of the Coast Salish peoples, specifically the Lummi Nation and the Nutcracker tribe. They have painstakingly cared for this land since time immemorial, and I deeply believe that this work that we do in health promotion should serve the Coast Salish peoples and all other Indigenous peoples around the globe by specifically working to rectify the inequities wrought by colonialism. So that's important context to set. I just want to thank you all for taking the time to be here today. My name is Hope Corbin, and I welcome you in my capacity as Vice President for the North American region. I'm thrilled that you're able to be here to join us. This is an exciting session for our region as it reflects the diversity of our membership, the ways the ideas of health promotion are variously enacted, and the challenges that we face as a region. So in the session today, I'm primarily a panelist, so I'm now going to hand it over to my dear colleague, Ann Pederson, to moderate. Thank you, Ann.
Thank you, Hope. Do you want to move the slide, Hope?
Sure.
Hope and I live very close to each other, but actually across an international border. And that means we have not seen each other in person since the pandemic. And so we are thrilled to be having a conversation that is almost in person and which recognizes that we both live on the unceded ancestral territories of Coast Salish peoples, but from quite different geographies. So in my case, the people that I would like to recognize this morning, and it is morning here in Vancouver, are the Musqueam, Squamish, and Tsleil-Waututh peoples who support the land on which I am able to work, play, study, and recreate. If you could move to the next slide, please, Hope. It's my pleasure this morning to frankly instigate the conversation that we're having among a number of members of the North American region of IUHPE. We have been excited to talk about and reflect on the state of health promotion in our own areas and to invite you to hear our reflections and think about what this might mean for you. Now, personally, I have been pondering these questions for decades, and some of that is reflected in 3 of 4 editions of a book on health promotion, specifically in Canada, that I've had the pleasure of being a co-editor on. And these books look at health promotion as it's reflected in policy, research, practice, studies, evaluation, implementation, theory, all of the above, but specifically in the context of Canada. And that's a reflection of our own, the strength of health promotion in Canada, but also our concern about its legacy. And I've been super fortunate to be involved in those books with one of my colleagues who you're going to hear from today, Dr. Irving Rootman. But these books are followers on a book that you'll see on the screen on the right called Health Promotion in North America, which is the report of a tour of North America, specifically the US and Canada, in the mid-1980s that was undertaken by leaders in the WHO and the UK who were preparing for that first international conference on health promotion. And I want to just read for you 3 or 4 sentences that I think set the tone for our questioning the state of health promotion as it is today. So here is from the first chapter, and I'm quoting. So health promotion in North America enjoys a high profile and considerable degree of commitment at national, local, and individual levels. At the federal government in the US, it is understood in much narrower terms than in either Canada or the UK, being seen as a process of disease prevention involving risk factor reduction in what is assumed to be a fit population. Canadian national objectives for health promotion are less clearly defined, but involve a broader notion of health derived from the WHO view that health is a social rather than a medical ideal. Action to improve health must therefore encompass changes in the social environment as well as in the individual, end quote. those lines have shaped my thinking about health promotion from the time I was a student at the University of Toronto in the mid-1980s. And they continue to animate questions I have about the relationship of individuals to structure, social to personal, as well as the geographic and national and global context in which the thing that we call health promotion happens. So with that as background, I'm going to invite a series of my dear colleagues from across NARO to join us one by one to present their thoughts. And we're going to start in the Caribbean and work our way to the West Coast. And so Hope, if you would move the first slides. And what we're going to do, this is quite informal. Some people have prepared a series of slides to help reflect their talk. Many have not. We have an initial guiding question that you've seen, which is, what is the state of health promotion in your area or context in which you work? What do you see as its main strengths and weaknesses or challenges? And so each person is going to speak about that for a few minutes. And then we'll move on to a second question, after which we hope to have time for dialogue with all of you. And we hope that you enjoy the conversation. So I'm going to start by inviting Desmalee Nevins to pick up from me. Thank you so much.
Thank you. Thank you so much. I speak today from Jamaica, where I live, and it's against a background that I've worked in health promotion, public health for over 30 years, recently retired, but still work as adjunct lecturer for the University of the West Indies and a few community projects. So in preparation for sharing with you today, I spoke with 4 persons across the Caribbean so that I could be updated on what is happening. So as I share with you the state of health promotion in Caribbean countries, please bear in mind that this is not just my opinion, but persons who are strategically placed have been able to update me on what is happening. Next slide. I am coming to you with the experiences of Jamaica, which has a population of about 3 million persons. Next slide. And also reflections from Organization of Eastern Caribbean States, OECS, which has a number of countries in the Eastern Caribbean that work together, and they form an alliance, and they are guided by the same kinds of resources and inputs that allow them to do what they do. These countries are, next slide, we have Grenada, Dominica, St. Kitts and Nevis, Antigua and Barbuda, St. Vincent and the Grenadines, St. Lucia, the BVI, British Virgin Islands, Montserrat, Turks and Caicos Islands, Anguilla, and Martinique. And next slide. So the essence of what I have gathered, and with my own experience, what I know is that the primary responsibility for health promotion in these islands and larger across the Caribbean is with the ministries of health. I must inform you that the Caribbean embraces the Ottawa Charter of Health Promotion, and we have gone ahead to develop on that to add an additional tenet, which guides, it forms the pillar on which we plan and do health promotion work. So the Ministries of Health have primary responsibility, the largest employer of persons working in health promotion. And in the larger country, like in Jamaica, and some of the smaller countries I have referred to, will have a central office in the ministry itself. It may be a division, it may be just an office, or a key person who has responsibility for health promotion at a national level. So they sit with other program managers, and they are responsible for policies and values and so forth. Then you have another tier where you have, depending on the size of the country, you may have a regional body that is closer to the community, but this regional body is responsible for a number of smaller communities and regions. And they also, so you have three tiers. The ministry, where there is that head office, division for health promotion, then a regional body, and then below that, you have persons who are closer to the community level. And there is advocacy that is accompanying what happens at these different levels, at the ministry level or at the local level. There is advocacy to involve others. Next slide. Next, yes. Now, you will find that a lot of what is done is driven by research. This informs plans, policies, and interventions. The persons who are involved in this research, which informs what happens in health promotion, would include institutions like the Pan American Health Organization, the University of the West Indies, the Ministry of Health, and other agencies. It may be private sector agencies, it may be agencies like UNDP that may fund, every now and again, they may provide funding for some research to be done. Next slide. The major areas of focus, therefore, are chronic. You will find that a lot of these areas of focus are disease or condition specific. So chronic non-communicable diseases is a challenge to the Caribbean in that morbidity and mortality figures show increasing levels over the years for chronic non-communicable diseases, and therefore there is special emphasis on that. Then there is a sexual and reproductive health program coming out of HIV, which has lost a lot of its support from international agency. So they have combined things now for sexual and reproductive health. My third bullet shows physical activities and wellness. And as you may imagine, this really supports the data that show that chronic non-communicable diseases are the challenge and eating up a lot of the health resources. So physical activities and wellness is a big priority, and it's done through a collaborative approach where workplaces, government or non-government organizations, schools, and community groups are involved. So there's a lot of advocacy and partnerships being developed, and it's not unusual for workplaces to be seeking assistance to carry out some of the things in their workplaces. So they work closely with the ministries of health. Next slide. There have been some challenges during the last 2 years in that with COVID, they had to be those in health promotion and organization across the board had to be working with constraints, functioning virtually. And therefore, there was a little shift in the focus in terms of whether or not they were focusing on these areas I mentioned earlier. And there was more a focus on dealing with this issue that is now challenging. And that included also doing research that would help to inform how do we get communities and individuals to take care of themselves and to understand what are some of the barriers to getting vaccinated and that sort of thing. Next slide. The strengths I see, or based on the conversations I have had, is that there is this shared vision of a healthy workforce that stands out, so that government and non-government organizations work together for this, in that there are large corporations, it may be even construction sites, large construction projects, where they work closely with the ministries of health to help them to develop programs that are activities that will promote and support wellness for their staff. So there is collaboration on interventions like healthy eating, physical activity, and the management of non-communicable diseases mostly, but also communicable diseases. Next slide. As I wind down, the challenges I see is that there are unavailability of resources for the supportive environments. So while there are a lot of things being done, there are, in terms of supportive environment, let's say, for example, we're talking about physical activity. How do we have walking tracks? Do we have recreation centers strategically placed for people to access? These are not there. So it is a lot of emphasis on individual and corporate entities coming together to get people to do things. Plus, there is this issue of the cultural norms that often run counter to some of the actions that are sought. For example, for non-communicable diseases, there are certain eating patterns and certain behaviors that are consistent with the culture, and therefore it's hard to get people to move from that. So where one of the weakness comes in is that there is not enough emphasis on, say, we're promoting healthy eating, then there needs to be availability, even in our imports and exports, for persons to have access and for them to in turn value those things and be able to act on them. I think that may be no, there's one more slide, I think, let's see.
Thank you so much, Desmalee, for getting us started with that overview of activities in the Caribbean. I'd now like to invite Stephanie Leach to speak.
Hi, everyone. Good morning, good afternoon, good evening, wherever you find yourself in the world. I'm Stephanie Leach, and I am coming to you from Trinidad and Tobago. For those of you who don't know where that is, it's the southernmost island in the Caribbean. I really wanted to thank my Caribbean colleague, Desmalee, for her reflections and, commend your efforts for trying to actually speak to people across the region to get their feedback, because a lot of what you shared is also reflected in my presentation, which is really just based on my own reflections of what's been happening in my country. Now, I'm going to be reading. Unfortunately, I don't have slides, and I'm not usually this prepared with like a full speech, so I hope I don't sound too disjointed, but hopefully we can talk more in the Q&A. So for my contribution today, I'll be focusing on my country, Trinidad and Tobago's COVID-19 response, which, like most other countries, is layered and complex. Very early on in the pandemic, Trinidad was praised by various development and health IOs for its management of COVID, including being ranked #1 in a report published by the University of Oxford that assessed responses to COVID-19 based on WHO criteria and largely focused on our small island development state's management of its lockdown measures. TNT also received positive reviews from the EU and World Bank in relation to how our low infection rates, that were presumed to be a result of these early onset lockdowns. And while this may be true and can be considered a strength, it also reflects the state's reliance on its machinery to legislate and enforce population control as its main strategy to promote health. We also know that lockdown measures did not always act in the interest of all people, especially within communities that were already marginalized, and in my context, that meant poor and Black people in particular. Luckily, I was able to capture some of those reflections in the article, Black Lives Matter in Health Promotion, Moving from Unspoken to Outspoken, which I wrote alongside many of my colleagues who are on this panel. We were able to map how the various derivatives of state control were being weaponized against Black people around the world in similar ways. And while I could talk and unpack this a lot more, I also wanted to talk about the factors that led to the decline of our management of the pandemic, including those acknowledged and unacknowledged by our government. As the article Health Systems Resilience COVID-19 Response in Trinidad and Tobago points out, our country faced many health system challenges: a lack of political will, evidence-informed decision-making, respect for science, and timely, coordinated, collaborative actions that can strengthen resilience and the response of the health system during a health emergency. It's interesting that summary seems kind of scathing, even though the article itself again seemed to be praising TNT. But from my perspective, the main public health issue 2 years into the pandemic has been the low uptake of the vaccine by the indigenous populations of Trinidad and Tobago. And I make this distinction since I have no way of measuring this phenomenon among our migrant population, which has been growing steadily over the past few years. We are witnessing the vax versus anti-vax wars playing out on social media, and individuals' lack of trust of vaccines and government intervention in general. But equally concerning is the fact that deaths are largely occurring within unvaccinated populations, and there's an increasing hesitancy to disclose your COVID status if or when you become infected for fear of stigmatization. This for me represents a compounded failure by the state to adequately educate the population on the vaccine beyond the mere health benefits, but to really think about and respond to the deep-seated emotional vulnerability that's happening below the surface and has real life and potentially fatal consequences. What has also been glaring is the lack of response to mental health concerns during an extended pandemic of more than 2 years, where isolation is a central part of survival. I often wonder why our professional psychology associations or mental health organizations have remained mostly silent on this issue, despite the enormous strain the environment of COVID-19 has produced within all human beings across the globe. And I don't think that this situation is unique. It's obvious that all countries are struggling to acclimate to this new environment and develop health promotion strategies that make sense for their populations and are sensitive to cultural specificities and the very real fear of not surviving this period in our history. As I myself become more concerned about my own safety as the pandemic continues, as a person living with comorbidities, I am struggling to find my own place in the much needed action that would require that every person is receiving the mind, body, and spirit support that we all so desperately need at this time. And the Caribbean in particular is vulnerable because we don't have the same type of institutional mechanisms that the global North has. And yeah, I just wanted to talk about this current situation as a way of illuminating some of the dynamics that were also there. I think my colleague Hope referred to COVID as the great equalizer or maybe an equalizer. So yeah, that's my contribution. Thank you.
Thank you, Stephanie. What a wonderful compliment to go from the more general ground setting information we received from Desmalee to a personal, deeply felt presentation from an individual and your unique perspective in TNT. Thank you so much. So now we'd like to shift gears and move to a bit further north and invite Irving Rootman to speak about what he's observing about health promotion in Canada. Thank you, everyone. Irv, you're muted.
Hi, everybody. I'm Irv Rootman, and I've been working in health promotion since the beginning of health promotion, and I'm still working in it after 15 years of retirement, much to the chagrin of my wife, but I'm going to continue to do it as long as I can. Before I begin, I too want to acknowledge that I live, work, and learn on the unceded traditional lands of the Musqueam, Tsel, Watooth, and Squamish Coast Salish peoples. So addressing health promotion in Canada comprehensively in a short period of time is very difficult because Canada consists of 10 provinces and 3 territories, and there are differences between them in relation to the state of health promotion. So I will limit my comments mostly to health promotion at the national level, although I have some comments about the provincial level as well. At both levels, there are 3 main areas of health promotion work, namely academia, government, and other organizations. With regard to academia at the national level, there's both good and bad news. The good news is that there are still active academic degree programs across the country where interested students can earn graduate degrees in health promotion. There also are many courses in health promotion that students can sign up for across a broad range of university departments. The bad news is that the university-based health promotion research centers that were active in 2007 when the last IUHPE conference took place in Canada are no longer in existence, nor is the Canadian Consortium for Health Promotion Research that organized that conference. With regard to governments, the federal government department that established the Health Promotion Directorate, which was one of the hosts of the first international conference on health promotion in 1986, eliminated that unit in the second decade of the 1990s. Currently, there's no unit in the Canadian government dedicated specifically to health promotion. At this moment, the main contribution that the Canadian government makes to health promotion is to provide funding to organizations to support projects related to health promotion, such as 6 national collaborating centers on public health, all of which support research and practice related to public health, including some health promotion. For example, the National Collaborating Center on the Determinants of Health has supported webinars related to health promotion in partnership with Health Promotion Canada, which is a recently established national organization devoted to health promotion. Currently, this collaborating center is hosting a webinar series based on a new textbook entitled Promoting the Health of Older Adults, the Canadian Experience. Health Promotion Canada is also working with other organizations such as the United Way to sponsor webinars on various health promotion topics. Health Promotion Canada has representatives in almost every province on their executive committee, of which I am a member. In addition to co-sponsoring webinars, it has established a national award program which recognizes people and organizations across Canada that have made significant contributions to the field of health promotion. Health Promotion Canada is currently engaged in a renewal process based on developing a network of networks, staying relevant and having a meaningful role in influencing government decision making and issues where health promotion can make a positive difference. Finally, another important organization to note at the national level is the Public Health Association. That was one of the other 3 sponsors of the first International Conference on Health Promotion. Since that conference, CPHA has provided a platform for discussing health promotion in their annual conferences and journal. 2 weeks ago, they sponsored a webinar with some assistance from Health Promotion Canada to celebrate the 35th anniversary of the Ottawa Charter for Health Promotion. Following the webinar, their executive director suggested that he would like to strengthen their relationship with Health Promotion Canada. So this ends my response to the first and second questions at the national level. However, before turning over the floor to Mathieu to speak about health promotion in Quebec, I'd like to quickly let you know a bit about the current state of health promotion in other provinces. I will do this by selecting some commonalities and differences in the responses to the first 2 questions from experienced health promoters in Alberta, Ontario, and Eastern Canada. One commonality that they agreed on is that the pandemic has significantly affected health promotion practice in their jurisdictions by redeploying practitioners. However, Tari Hookinson from Alberta said that she believed that the strong abilities of health promotion practitioners to build systems, create processes, and engage and educate shone through during the pandemic, demonstrating the strengths and potential of the health promotion workforce. Also, in Eastern Canada, Patsy Beatty Huggan and Laura Lee Noonan suggested that during the pandemic, as social issues became a public health concern, health promotion groups from across the region came together to share experiences and knowledge to address social issues. Another commonality that respondents from Ontario and the Atlantic regions agreed on is that there has been a trend at the provincial level to reduce public health capacity and decentralize health promotion activities. However, Tari noted that in Alberta, the vast majority of active health promotion practitioners work for the provincial health authority. According to Brian Heineman in Ontario, the state of health promotion was pretty dismal even before the onset of the pandemic. The last provincial level organization supporting health promotion practice closed in the spring of 2018 when the Ontario government dismantled the remaining health promotion resource centers. According to him, all mention of health promotion was omitted from the current iteration of the Ontario Public Health Standards, which lays out program and service requirements of Ontario's public health units. However, there are still people working throughout Ontario with health promotion embedded in their job titles. Also, Public Health Ontario has a health promotion, chronic disease and injury prevention division that's heavily focused on applied research. There's also an organization in Ontario called Health Promotion Ontario, which is associated with Health Promotion Canada. Finally, I'll conclude my presentation by acknowledging that the field in health promotion still has some strengths that we can build on to deal with the limitations above and revive the golden area of health promotion, which followed the International Conference on Health Promotion, which produced the Ottawa Charter for Health Promotion, that's still relevant as a framework for collaboration across a wide variety of fields, as we demonstrated in our recent book on promoting the health of older adults, which had authors from a wide variety of fields. I was also very happy to hear that the Ottawa Charter is alive and kicking in the Caribbean. So to sum up, health promotion in Canada is not dead yet. In fact, it's rising up under the umbrella of Health Promotion Canada with some enthusiasm for using new approaches to strengthen the field. So that's all I have to say now, and I can join in the conversation later. Thanks.
Thank you, Irv. So continuing our conversation and presentations in Canada, I'd like to invite Mathieu and Nikita to talk to us about health promotion in Quebec.
Thank you, Anne. Thank you, Irv. If you ask me what is the state of health promotion in my area, the French side of the province of Quebec, the French side of Canada, I would say that the state of health promotion is currently weakened by the COVID-19, but I think it's pretty much the same situation everywhere on the globe. Currently, the public health response in the aftermath of the pandemic and the actions that the government undertook were much more directed toward health protection or disease prevention rather than on promoting health, psychosocial well-being, or any capacities to cope with daily stressors. Even though I definitely understand that these actions are required in the acute and emergency phase of a pandemic, the public health response in the aftermath of the COVID-19 should also promote psychosocial recovery of individuals and communities, especially when a pandemic lasts more than 2 years, as it is actually the case. So I'm worried about the state of health promotion right now, because I think that the pandemic will stay for more years, and I would like to see more health promoters, you know, taking this place to promote psychosocial recovery, to create mental health capacities, to create social ties. I think most health promoters should take up this place. Being able to develop personal abilities to cope with the pandemic or to create conducive environment for well-being and quality of life should be core component of a good public health response in time of pandemic. I think health promoters should develop this and integrate it within the management of public health emergencies. So currently, I would say that I'm worried about the state of health promotion in my area. If you ask me what are the strengths of health promotion in my province, I would say that health promotion is taught as a discipline, but also as a core function of public health in universities, colleges, and schools. So I think this ensures that the community of health promotion practitioners and researchers meet themselves on the school benches and rub shoulders together throughout their all careers. So I think clearly this is a strength because in general, we well know each other. In addition, people who work in health promotion come from a variety of scientific field and practice areas, so their background is vast. And this has the effect of creating a rich dialogue full of potential innovative ideas. And what are the main challenges of HP, I think, in my area? I definitely think that the main challenge of health promotion is that health promotion is still too much considered in terms of deficit rather than in terms of assets to produce health and well-being. Health promotion is about resource, it's about capacities, it's about opportunities, abilities, and positive health concept and measures. And too often, health promotion is considered as the inverse of disease prevention, and it is much more than this. Within my own research, I have many concrete examples of this. Once, while I was interviewing a community dwelling senior in my research, one woman told me the story of her family doctor, you know, who focused too much on how to prevent arthritis. However, what this woman wanted to know, this is how to keep her skills to drive her car, because not driving anymore was a social death for her. That was much more important for her than treating arthritis. Another example, if this man will reply to his doctor, please stop talking to me about my diabetes. I have diabetes for over 15 years and I manage it very well. Instead, I want to be able to keep my grandchildren at home. So this is about health promotion, and this is the main challenge we face right now, I think. So Nikita, you can move with your answer.
Thank you, Mathieu. I live in Quebec as well, so I fully support a lot of what Mathieu has said. But when I thought of, well, what are the challenges of health promotion in my field, I tended to think of it as a consumer And so what I would also add to what he has said is that when I think of health promotion as we define it in terms of the processes of enabling people to increase control over and improve their health, I see a couple of gaps. For one, I think that we are still a little bit siloed in that there are many things that impact health that don't fall squarely under public health or health promotion, and those sectors need to interact with each other a bit more to give us the responses that we need. I also think that we struggle in health promotion with some mixed messaging. So I think we're struggling with health communication, which is lagging and falling into health literacy. And the pandemic is a fantastic example of how that plays out, which then leads to my other concern, which is trust. You tell people one thing today and then tomorrow there's something else. And how are folks really supposed to make the best decisions for their health when they can't piece together the information in a way that makes sense to them? And I put that blame a little bit on our shoulders as professionals in terms of learning how we can communicate in a way that people can interpret and understand and make positive choices from. And then, of course, we see that there is a lot of skepticism when it comes to vaccines or other things that is causing an issue for health promotion and people's ability to make the choices that they feel will best enable their health and how we respond to that. So that's basically what I would add to everything else that Mathieu has said.
Thank you, Mathieu and Nikita, for those additional reflections. One of the observations that you've probably made by now is that we made a deliberate effort to make this a multi-generational webinar. We have discussants at all stages of careers, and we hope that that's reflected in the observations you're hearing. I certainly see those positionalities as relevant to what we're hearing, and wanted to just be explicit that this was intentional. We'd like to shift now to invite our US-based colleagues to together give us a perspective on what their views of the state of health promotion from each of their unique places, starting with Marti Rice.
Thank you, Anne, and good day, everyone. I am speaking to you from Palm Beach Gardens in the state of Florida in the United States. I'm going to share with you not so much specifically US perspective as much as the perspective I've gleaned from working for the Pan American Health Organization, which is the office of the World Health Organization for the Americas, and it covers Canada, the United States, and the English-speaking Caribbean. So I hope that that will be acceptable to all of you and not just strictly focused on the US. And the next slide, please. So in terms of answering the questions that we're addressing today in terms of context matters, health promotion in the Americas. Next slide, please. First and foremost, I wanted to talk about an important document for health promotion in the Americas and for the NARO countries. And the Pan American Health Organization in 2019 came up with its next strategic plan of action for health promotion for all of the countries. It goes to the year 2030, and it has 4 main lines of action with specific things that countries can be doing to promote health, as well as indicators for accountability. One of the key lines of actions is to strengthen key healthy settings like schools, like communities, like hospitals, like markets. So there's a lot of different settings that we could be looking at and addressing from those particular places how health promotion can be generated. The second major line of action is enabling community participation and empowerment and civil society engagement in terms of not just identifying what the issues are, but what are the resources, what are the assets, how can policies be developed to support what's going on at the local level. A third major line of action is that of enhancing governance and intersectoral action in order to improve health and well-being and to address the social determinants of health. And I think we've heard from all of the presenters so far about how the social determinants of health are really key in order to promote and sustain health in our populations. And so health promotion, I think, needs to be at the vanguard of drawing attention to those determinants and getting many different sectors to address them. Finally, the fourth major strategic line of action is that of strengthening health systems and services by incorporating health promotion as an approach in the delivery of those services. Excuse me one second. We've heard how there's been a lot of transition from looking specifically at diseases and treating diseases to looking at conditions that can be created to get people healthy and maintain their health. And I think it's really important that the systems that are delivering health services think about the broader perspective and not just addressing the diabetes or the other non-communicable diseases, but what are the causes of those conditions and how can those causes be addressed? And I feel like if it's not those working in health promotion that are pushing that, the system is not going to be aware of it and respond to it. Next slide, please. In terms of strength and opportunities, in the US, every decade they come up with a national policy called Healthy People. In this case, it's 2020 to 2030. They're looking at the social determinants of health. They're also looking at systems and settings. They're looking at specific populations and how, from the population perspective, health can be promoted, and they're looking at behaviors. And I think it's really important to understand that the US has really transitioned from looking at specific diseases to looking at the conditions that can either create those conditions or create those diseases, or support overcoming them. Another major strength and opportunity, I think, with health promotion is that of recognizing the cost effectiveness and the economic savings that you get from health promotion and from preventing problems. And very often with people that see the effect of different diseases and different conditions, and they don't see the effect of health promotion, we need to make that cost effectiveness argument for them to understand why it's better to prevent than it is to treat. A third major opportunity is that of health education, health promotion certification systems, where we have actually people certified in our field. The US has a health promotion, health education certification system, and the IUHPE has one. And I'll talk a little bit more about that when we address our second question and the advantages of being part of the IUHPE. Another major strength or opportunity of health promotion is that of advocacy, training, and support. In the US, we have the Society of Public Health Education. In Canada, there's the Canadian Public Health Association and Health Promotion Canada, and a number of other ones that Irv has mentioned. In the Caribbean, we have the Canadian Public Health Association, the Caribbean Public Health Association, and Desmalee has mentioned a few others. In the US, there's the American Public Health Association, and finally, there is the IUHPE, the International Health Promotion Education Union, where opportunities are being offered for training and support. And finally, another strength and opportunity, but I've put here, it's a double-edged sword, is that of social media. And as a number of you have mentioned the issues related to COVID, we've seen the real challenges in terms of social media of trying to counteract the misinformation that's put out there. And I think it's a major responsibility as well as a burden on health promotion to see how we can make sure that we use the social media that gets to the widest number of people. So the diversity of the different social media is important, but also to do everything we can to use credible people to counteract the messages that are erroneous, that provide bad information, and to promote the correct information. Last slide, please. Last slide, please. Oh, thanks. So, and then finally, to finish off with some of the challenges or weaknesses related to health promotion, I think we have a real challenge in terms of documenting our successes. Those that are involved in research are very good about publishing in peer-reviewed journals, but I think that that is just a slice of all of the wonderful work that is being achieved. And I think to the extent that we can use not necessarily peer-reviewed journals, but all kinds of other channels to get the word out about successful interventions and what we've been able to achieve with health promotion, I think is really critical, and we can do a much better job with that. I think we also need to strengthen our collaboration among countries to share experiences and lessons learned. We need to be better at establishing networks and communities of practice. With PAHO and WHO, we have a number of collaborating centers, and we try to get them to work with each other. But I think we need to be looking at how we can form more networks, especially using virtual communication, to really be able to get people to share their experiences and their lessons learned. And it's also an opportunity when people are facing challenges to be able to talk to each other about, well, how have you dealt with this issue? Have you seen these issues? What are you doing to promote health promotion in particular contexts? Another challenge I think that we need to overcome is the preparation of effective evidence-based arguments for promoting intersectoral collaboration, for addressing the social determinants of health, for looking at equity. And COVID, I think, was a great example of showing us how we really need to look at these issues of equity, community-based practices, and scaling up for replication. It's great when we have a successful experience in one community, in one province, in one state, but how can we get that to go broader across the country and across countries? And finally, I think another challenge that we have is really strengthening public-private partnerships. The private sector very often has the financial resources, where the public sector has the technical resources, that we could really try to find common goals and work together to support and expand our health promotion efforts. Thanks very much.
Thanks, Marty. I appreciated you reminding us that you had this larger contextual look, and we're not going to keep your marks exclusive to the US. Thank you for that fantastic overview. I'd like to invite Bill to join us.
Thanks so much, Anne. And you know, I love being part of this, and I appreciate the opportunity to do it. I learned so much from my Caribbean and Canadian colleagues every time we connect. And it's also, as always, great to hear Marty's thoughts. Marty did a great job of setting up the, the larger scale issues that we're dealing with. I've been asked to focus primarily on the schools setting, since I've spent much of my career in that area, and retired from CDC a couple of years ago. And these thoughts are obviously my own. You know, everyone has spoken to the challenges that the coronavirus pandemic has levied on health promotion efforts. It's also given us a number of opportunities. But you know, in particular, the pandemic has really shone a bright light on a couple of real problems that we have in health promotion, which, you know, can be political interference and also inequities and the great you know, divisions that appear in our culture, partly due to those inequities. And you know, it's just so important for all of us to continue to consider how we can positively address, through health promotion efforts, those inequities, and you know, and reach those sustainable development goals as a result. Some of the opportunities that have occurred, you know, in schools, we've had just an unbelievable experience trying to pivot to virtual instruction, which no one was trained to do, and you know, and then making sure that young people are supported, particularly, you know, with their social and emotional needs. And we've learned so much over the last couple of years about how that does and doesn't work in the education sphere. We've got some real challenges in health education and making sure that health education stays prominent in especially public schools, but also private. We also have some real challenges that are becoming more and more apparent around mental health issues with young people. And while we've talked about that in health promotion for decades, the pandemic and the social isolation that occurred partly due to the necessity of keeping people apart and connecting virtually has really caused major problems in terms of young people's mental health outcomes. Some of the opportunities for us, though, there has never been such a focus on schools in terms of their importance in promoting health and their importance in making sure that students stay safe and supported on their academic journey. There's never been such a light shown on mental health as well for young people. The entire tide of social emotional learning programs that we're seeing in the United States and the emphasis on social and emotional learning has really shot to the top of the priority list of most school administrators in the United States. That gives us great opportunities in the health promotion field to leverage the importance of social and emotional learning and make sure that we have physical and mental health promotion efforts engaged in that. The whole school, whole community, whole child model gives us a framework to work within in terms of providing those efforts. I think also finally connecting with parents is just incredibly important and becoming more and more important as we see parent issues popping up throughout our culture. Many times parents feel disenfranchised on some of the health promotion efforts. And so thinking through carefully how we can engage productively with parents and parent groups is another avenue that I think is a great opportunity for us as health promoters. So those are my primary thoughts for the moment. I'll be happy to discuss briefly how the IUHPE has been so super helpful for us in accomplishing some of that work in the past. And thanks so much, Anne.
Thank you, Bill. We look forward to that follow-up conversation in a moment. Hope, I'd like to invite you to be the last of the speakers addressing this first question. I know you have a unique perspective on health promotion from your vantage point.
Great, thank you so much, Anne. And thanks to everyone for being here and for giving your presentations. It's been really fruitful to think about how health promotion is approached from different parts of the region and enacted in these various settings. So I'm going to be answering this question from my perspective of someone who, while I work in the US, I was educated in Norway. And so I'm coming from a different orientation to health promotion than many of my colleagues in the US. And so I find that I'm constantly thinking back to the difference of the approaches in those two countries. And I think that I'm always thinking about health promotion as being primarily concerned with inequity, with health inequity in particular. So I've chosen to organize my talk drawing on Fran Baum's idea of the Nutcracker approach to health promotion. So this is a diagram that accompanies her article, Cracking the Nut of Health Equity, Top-Down and Bottom-Up Pressure for Action on Social Determinants of Health. And in the paper, she makes the argument that health inequity requires a combination of health promoting policies and political action and bottom-up organizing and leadership. So I think that one of the key challenges that Bill definitely touched on for the US is just the size of this nut in this particular context. I think that inequity in the US is really egregious in terms of the amount of resources that as a nation we have access to. The organization of our society, its policies and institutional practices have deeply embedded structural inequity that is a challenge for health in every way. So classism, racism, ableism, homophobia have been codified into many of our institutions, from the way that schools are funded through property taxes, historic redlining policies that have influenced housing in the country, various levels of policing in different communities, access to healthcare, access to mental health services. We just see it everywhere. And as a result of the arrangement of these social determinants in our society, our population experiences huge discrepancy in life expectancy, morbidity, the age of the onset of disease, the experience of violence and injury. And this has been proven with the experience of the pandemic. We see it, that it's impacting marginalized communities to a greater degree. So I know that none of this is new, but I think that it's just still super important to like acknowledge that that is a key challenge for the US. I think an obstacle to embracing the strategies of health promotion in the US as a whole has some philosophical roots. I think that we've seen, I've seen just since I started at my university in 2013, I have seen a lot of movement from part of what Anne was reading at the beginning of the session, from this emphasis on disease prevention to more discussion about the social determinants of health. I think that people are talking much more about that. I think that some of the work happening in schools reflects settings approaches. And my university just recently signed the Okinawan Charter and is working as a health promoting university, which is exciting to me. But I think even with this progress, we still continue this battle with the default tendency in the US to think at the individual level and to think about individual responsibility and rely quite heavily on the personal skills action area of health promotion, and to overemphasize behavior change strategies as opposed to environmental or policy strategies. I think this has been a barrier to the wider adoption of health promotion strategies that focus on policy and environmental changes on a broad scale. And I think that political actors fundamentally disagree about this. So it's very difficult in the US political context to actually move legislation that would meaningfully impact health equity. I think the strength, so I think that the weakness is the size of the nut, and I think that our ability to enact that top-down pressure is a challenge. I think where the US really shines is in the community action part of this equation. I think that we are incredibly strong in bottom-up action. The diversity of our population and the history of activism as an effective pathway to social transformation and policy change is, I think, inspiring for many community actors and really a necessity for many communities, because it's the only way to communicate about what they're going through. I think the problem from my perspective is about like legibility in terms of health promotion, because I think that many of the activities that actually, well, many of the activities that are labeled health promotion in the US are actually not health promotion, they're health education or disease prevention. And many of the things that are actually health promotion, the people doing that work have never actually even heard of health promotion. And so they don't recognize that as such. I'm thinking here of movements like Black Lives Matter, Dreamer activism, environmental justice groups. I think this is a real tragedy, because connecting up these efforts with the larger health promotion movement could really, I think, benefit both of us, because we have 40 years of experience with research and they have on the ground tactics that are working right now. And so I suppose this is where I think that IUHPE has a role that we can play as an organization. And it's why I appreciate it so much. I think like Irv was saying that there are so many people just like in their little offices doing health promotion work and are disconnected from larger systems. And I think that within the IUHPE, we have a home and we can talk with like-minded people and learn from each other as we, really work to try to enact this vision of a more equitable world.
Always inspiring hope, and I hope that others can pick up on your reflections on the role of IUHPE. I want to thank everyone, first of all, for just that incredible level of reflection and the time that everyone has put into preparing to join in this conversation today. We've talked about this for a couple of years, and I'm just really delighted that we've put this together. And thank you, IUHPE, for the opportunity to both do this and record it for others who are not able to join us today. So, Bill, you've already taken a cue, and I wonder if you would start us by building on what Hope had to say about the potential or actual role for IUHPE in influencing your thinking and work. Thank you. And then we're just going to go back through the list, everybody, the way we started in reverse.
Sure. Thanks so much for the opportunity. And, IUHPE's been so influential, personally in terms of making connections around the globe whenever there have been opportunities for us, in our work at CDC or in my previous work in Boston or Washington, D.C. or Denver or in Missouri, just having those relationships and those personal connections with people who are so skilled and so knowledgeable on health promotion efforts is just, has been just really super important to me. And I think for me, a major value is having those personal discussions about issues that we share that are not just, issues that we have in our country in the United States, but are often the same types of issues, whether they be in Hong Kong or Delhi or Cape Town or Rome or anywhere else in the world. So I think it's just so important for us to continue that networking and getting to know each other at a deep enough level so that we can connect when we have issues of common concern.
Thank you, Bill. Marti.
Thank you. Well, Bill has said a number of the things that I wanted to say. I won't repeat it, but I think that the network of like-minded people is really, really important. Throughout most of my career, I was kind of like the expert in health promotion or health education, and everybody else that I was working with in my organization represented different perspectives in different fields. So it was really important to me to have a network of people with whom I could consult that were thinking about the problems in the same way I did and coming up with solutions. And so often, if I had a problem, I could consult with people in the IUHPE network. I want to mention that the IUHPE has 7 global working groups. And those working groups are not only places that one can go to consult, but also they put out policy statements. When issues come up through the working groups, we've worked to put things up on the web for the IUHPE in response to things. I'll just mention them. There's the health impact assessment, there's health literacy, there's salutogenesis, there's social determinants of health, healthy settings, a new one, mental health promotion, and the WIORA planetary health. And I chair one of those working groups. I sit on a number of them, and just through the working groups alone, I've just learned so much in terms of addressing those specific issues. And of course, those issues are generic issues that are ongoing. So as things evolve, like when we got COVID, each of the working groups was looking at how we could address it. I think it's also important to recognize the IUHPE has global conferences, it has regional conferences, it has webinars like this, it has workshops, and that has provided me an opportunity not only to link with other people, but to learn from other people and to constantly be hearing about the struggles that people are having, how they're overcoming them, and the lessons that they've learned. We have the Global Health Promotion Journal, we have our newsletter. Those are also things that have really enriched me when I'm reading what's happening and finding out what's going on, not only in my own country, but in other parts of the world and how people are dealing with those kinds of issues. So it's provided me enrichment through my networks, through my colleagues, and it's given me an opportunity to volunteer in a way that I could not in my own community or my own organization. Thanks.
Thanks very much, Marty, for that. Nikita, I'm looking to you.
Yeah, so definitely 3 things came to mind. One was collaboration. I found IUHPE to be a great place to collaborate on different health promotion projects, such as this one that we're doing right now. I also looked to IUHPE for thought leadership. As Marty said, a lot of the various working groups do put out papers. And so if you want to see or learn about what the latest thinking is on certain issues, I find that IUHPE and their working groups is a great way to do that. And then the third thing that I thought about when it comes to how IUHPE informs and influences my work is just exposure to different contexts. I don't think I've been in a meeting for IUHPE where there has been probably less than 2 or 3 countries represented. And so you always have the opportunity to hear what's going on in different contexts around the world and how other people are tackling the issues. So those are my reflections.
Thanks, Nikita. Mathieu?
I'll be very quick with this one, and I will be not very original. I will be like the other colleagues here. IUHPE informed my work definitely throughout networking. Networking during meeting when we are able to see each other in real person. During meeting activities, webinar, such as it is the case today. These opportunities allowed me to meet people who have ideas or research activities similar to mine, or even better, complementary to mine. So in my personal case, this allowed me to contribute here with you guys on the NARO board, to contribute with the global working group on salutogenesis. So I was able to meet people and to develop various friendships all over the world. So thank you.
Thank you for that. Irv, do you have some things you'd like to say about IUHPE?
Yes, I do. Given that I'm still very much involved in health promotion activities in Canada, in spite of being retired for many years, I value my connection to the worldwide community through IUHPE, and especially the working group on health literacy, which was very helpful in keeping me informed about what's happening in the field of health promotion, and more importantly, helps me stay in contact with friends and colleagues that I've acquired over my long career in health promotion. So I've noticed that everybody who's spoken before me is putting forward a positive view of IUHPE, and I have a very positive view of IUHPE, but some of the people in the trenches have some significant problems in relation to IUHPE. So I'd like, if you let me, to read the responses that I got from 3 people who are working in the trenches. So Tari from Alberta said, unfortunately, IUHPE doesn't inform and influence my work life. We do not yet have performance conversations that include health promotion competencies. No employers that I know of ask for certification or accreditation to hold a health promotion role. Many current promotion practitioners come to the field without any formal training in health promotion, although they may have come from allied fields. Unfortunately, these fields typically have an individual-based approach, and there's a steep leaning curve, especially in community mobilization, building community capacity, and advocacy and policy development. Ideally, we need a shift toward competency growth, which would naturally lead to more interest in Health Promotion Canada and IUHP competencies. Brian from Ontario said, I occasionally access articles from Global Health Promotion and am asked to review submissions once in a blue moon. That's about the extent of it. Within the broader public health community in Ontario, I don't get a sense that IUHP has a major role in influencing practice. I think that the people who are aware of IUHP view them as more of a global international health organization, and attendance at their conferences is out of reach for most health promotion practitioners with limited or no travel budgets. And finally, from the Atlantic region, Patsy and Laura wrote, to this point, our greatest involvement has been promoting and attending IUHPE conferences. However, more recently, we've become aware of publications and webinars that we can promote and disseminate. We're looking forward to attending the IUHP conference in May. So there's a couple of people on the ground that are coming to the conference in Montreal. I guess that maybe nobody's coming to it in person, but anyways, if it was going to go on the way it was supposed to, they would have been there.
Yep. Irv is foreshadowing the news that many of you have probably already received, but that the IUHPE conference schedule for May has been announced this week that it will be fully a virtual conference. And so details will be forthcoming on how that affects the program. The early bird rate still open until this Sunday. So please encourage others to join us. We have a couple more people to hear from, and then we have a couple of questions in the chat. So hopefully we still have some time for that. So I'd like to ask you, Stephanie, if there's anything you'd like to add to the conversation, please go ahead.
Yes, hi again, everyone. I think that something that Hope said really resonated with me, which is that a lot of people who are doing health promotion work don't identify as health promoters. And I think that was one of the contributions that Irv made, but the person who gave the contribution framed it as a problem, whereas Hope defined it as an opportunity, because I myself primarily identify as a feminist activist, and my areas of focus include gender-based violence and sexual and reproductive justice, which is obviously health promotion work. I didn't really consider it in those terms specifically, or understand that this was like a specific area, discipline, etc. And how I ended up becoming a trustee at IUHPE was through Hope, because I was writing a book chapter on public health about my gender-based violence and specifically femicide advocacy. And I know that Hope is officially the VP, but really she's the MVP. And she deserves all the praise, because I think that what has been like deeply affirming coming into this space, as the only Caribbean person, as a young Black queer woman, has been to really see the politics in action that Hope demonstrates as a leader. I'm a kind of rebel activist. I don't, I'm kind of tangentially attached to a university, but not really. And my work and contributions, my academic contributions can still be valued. Just providing opportunities like, for example, I don't know if she's gonna mind that I say this, but in one of the articles that we co-authored together, she offered for me to be first author, which was obviously my first experience, having that opportunity. So, I was talking to another Caribbean sister about, recommending her to be on the board. And she's like, well, how is it like with all of those white people? And I said, my experience has been really good. And that's the greatest stamp of approval that you could give to another, marginalized person who's, wary or has reservations about joining a white dominated space. And it's been a good experience for me, as I said, sorry, the breeze is blowing hard here, under Hope's leadership. Connected to that kind of conversation around institutional backing. It's important, again, because of my identity, to have those kinds of networks. I mean, I think people value or can extract value from networks in different ways. But for example, my main orientation over the past decade has been with NGOs. Just fell out. But for a brief time, I worked for the UN, and it was, like, frankly shocking to me how differently I was received as a representative of the UN versus the representative of a civil society organization. I mean, I was like directly having access to government policy and like literally typing in comments that the government would take on board, which is something that was unimaginable for me as a civil society actor. So we started conversations within IUHP, but I am interested to know how having the support of this institution can help me start having conversations, with my own government and Ministry of Health around things that they wouldn't take on board from me as Stephanie Leach, but they might, listen if I say, I'm a member of this organization. So in those ways, it is strategic, but it's also like a real way that IUHP can support people from the global South, or people with hostile governments, or just, having community that is willing to help you figure out solutions. So that's been my experience.
Stephanie, your comments raised so many for me as well, but given the moment, I would also like to echo that I have been nothing but impressed and grateful for Hope's leadership and the network that she's brought together. So that was a wonderful tribute. Thank you. Desmalee, I know that you logged back in. Would you like to say a little bit about IUHPE?
Yes, I'll be brief. I must say that I have benefited professionally and personally by being a member of IUHPE. I have had the privilege of meeting so many, a variety of professionals. Some have mentored me, and I have been able to draw on the expertise of others to share in our training of health promotion specialists at the University of the West Indies. And I specifically want to highlight the work of Susan Jackson, who has really done some good work with us and helped us to shape our program. I have benefited from getting resources through IUHPE to inform our training program, and I feel good to know that I'm connected with my colleagues across the globe. I read the publications. I've had the opportunity to be co-author of an article that was published in one of the journals of IUHP. So overall, I think it is a benefit to be present. However, there are those that I mentor, and because I was involved in training for persons across the Caribbean, and I've tried to get them to tap in on the resources of IUHP. But one of the limitations would be the cost of even attending conferences and to contributing to the journal. So I've shared and I have promoted this, but I know I'm not sure how much longer I will be in as I am now, seeing that I am out of the mainstream of the workforce. However, I think there are so many benefits, so many things to learn, so many people to meet. I like the diversity, and I would love more of my colleagues in the Caribbean to be able to have access to this kind of exposure. Somehow it will work.
Thank you, Desmalee.
Just to add, I'm sorry.
Sorry.
Just to add, I was finished, but I just remember there's one person who is presently in training health promotion persons at the University of the West Indies who are invited to this webinar and is here, and she just like to acknowledge her, and she's one of those who will have to carry on the work, Mrs. Dawn Walters.
Thank you for that lovely acknowledgement. We are really close to time, but I would like to invite Suzanne very quickly to raise the question that she's raised in the chat, which I think, you know, in some ways encompasses a theme throughout all of these remarks, which is, does it matter if things that are happening are health promotion if they're not called health promotion? And I know that HELP has some words that she'd like to offer. And Suzanne, if I've misstated your question, please pick up on what I've said.
No, I mean, I'm a diehard health promoter and I love health promotion, and I constantly see the value of having the whole view, because it gives you so many different perspectives and strategies that you can use when you're analyzing and looking at a situation and understanding what's going on. But I'm interested in situations where we're talking about health promotion weakening a bit, but it's diffused. It's in different, things are happening in different ways, but they're not being called health promotion. So I think it matters that we connect it to health promotion, but I'm just being provocative to say, does it really matter? So anyway.
I think it does really matter, and I think there are ways of doing that. For example, this book that I was talking about, Promoting the Health of Older Adults, the framework for the book was the 5 action areas of the Ottawa Charter. And we had authors from a wide variety of fields who could relate to that. And it's coming out in a book that has a health promotion stamp on it. And that's one way that you can get academia on side to understand something about what health promotion is all about. It's not the only way, of course.
Hope you were going to offer some reflections.
I just see Stephanie's raised her hand though, so I'm curious what Stephanie wanted to say.
Yeah, I was just gonna say, like, this is not a health promotion specific debate. In the feminist movement, it's been ongoing for the past, 70 years. Should you call yourself a feminist is, work that women are doing, and not calling feminist work as important. I think every discipline comes across this question, but really it's why is it important? Is it just for some, strange human need to classify things? Is it for bolstering your own ego so you can claim other people's understanding of the world? Or is it, because you see real value in solidarity between movements, and, a strategic way to move the agenda forward? And I think the more that I ask myself that question, I don't really need other people to define things the way that I define them. I don't even know, I don't really understand that impetus. I think it really is just about understanding what the areas of common ground are, respecting others' positions, and, trying to figure out how we change the world together. that's the bottom line, really.
Yeah, I really agree with everything that Stephanie said. And I also just thank you very much for all of the comments. I love working with you so much. But I think that I feel like it strengthens on both sides. You know, I think that as a discipline, if we are going to be anything but a white dominated space, I think that we need to really start looking at leaders who are doing this work and advocating for communities that policymakers currently do not quite understand the experience of. And so I think it's crucial in that. And then I also think that people are having to reinvent wheels that we've figured out, you know, that we've theorized, that we have created strategies to address. And so that's very simply, I know we're past time, so I'll keep it short, but I think that at least those two reasons are why it's important to try to connect with other people doing health promotion.
Well, that was a wonderful way to spend, for me, my morning. I wonder if anyone else has some final words they'd like to offer. We've heard from a couple of people who were attending. Is there anyone else before we wrap it up for today who feels a burning question? I know Elaine had a couple about, you know, is health literacy the dominant framing now for health promotion? Are there people continuing to come through school? Like, is the pipeline for the future intact? I think those are questions we can pick up on in another time, but I wanted to invite those who have stayed to join us if there's anything you'd like to ask of our panel.
Maybe just a comment on that, that comment on health literacy. I don't consider it to be the only way to go, for sure. It's just one strategy, and it falls into personal learning rather than one of the other categories in the action areas.
Thanks, Irv. I would like then, on behalf of all of the members of this panel, and for IUHPE as a whole, as a member of the board of the IUHPE executive, to thank everyone on the panel for joining us today across all of your geographies and time zones. And for those of you who came to listen and hear our thoughts, thank you very much for making this a priority. Please know that this is being recorded and will be available to others on our YouTube site. And just a final reminder that we are gathering, albeit virtually, in a few months' time to extend this global conversation, and we hope to see and hear all of you there. So thank you very much.